Our family has a strange history with cancer in that most cancers are there because of hereditary reasons, but we've had 3 cancers in the family. Marilyn had, I had, my son who's here had. And we were the first in our family in each cancer. They're all different. To be, you know, to have, to go through that. And we went through this horror of cancer, and even all of them have been cured. We're all, you know, totally cured of everything. And everything that we did was done at the system at Northwell.
We feel very connected and how important this is. And I know many years ago, my grandmother had cancer, and I'm going back like 40 years. And I took care of her, and I took her for radiation. And the difference now in the care is incredible.
What we do at the health system is really special and unique, and I think everybody, you know, should take pride in the way that we manage patients. It's a very patient-focused organization, and if all we do is just put the patients first, then everything else happens around them in terms of their clinical care, in terms of their experience, and then obviously the education and research, which is vital. And that's a message that doesn't exist in a lot of other organizations.
I learned in growing up in it, and rather than just joining it late and joining this system late, I found that the people, and it's a lot of them are you guys, a lot of the people are people who are here today. It's the people that really makes the organization. You could buy equipment, you could buy a lot of these things, but you got to grow the people, you got to make them fit into the culture, and it's the people that I met and the people that gave me confidence in this system, and several of them are the ones that were on it tonight, and you know, Conti Rai and Kevin and people who I've met through the system that are just amazing. You know, Stacy. You know, we're not the strangers. We're all the friends of the system. We're all been here. We've all been involved, and every one of you will say the same thing, that it's delightful being involved with all the people who are involved in this system, and it gives you a lot of confidence, and then the management of the system brings you all the infrastructure that allows the confidence to come to great conclusions. And we are starting to get in the system terrific endpoints of almost everything we're doing, which is giving us, in a very short period of time, a national and international you know, event.
This conversation is about impact. There aren't a lot of professors at Northwell yet, but they're growing. And maybe you could talk a little bit, you know, just the concept of having that chair, what does that mean?
You know, and I was quoted as such, you know, terribly humbled of the opportunity, and tremendously thankful for the gift, and it really means a lot to me. It's going to create an ongoing and lifelong endowment in outcomes research, which is something that I think that we can impact patients with immediately. You know, I'm not a molecules guy. There are plenty of molecule guys out there. I'm more of an impact guy, and working with data and understanding how we can, you know, impact patients immediately. And I think this is going to create an ongoing enthusiasm.